Those who have the textbook, please mention the page number in the chat box. So first, we'll discuss briefly about the MRSA and VRE infections, methicillin-resistant Staphylococcus aureus infection. Okay, so it is caused by a staph bacteria. Okay, Staphylococcus bacteria, and which has become now resistant to many antibiotics. That earlier we used to use it for ordinary staph infection, but now it is not working on this particular strain of bacteria. Okay. And this infection can occur in people who are in hospital or healthcare settings for a long time. Okay, nursing homes, dialysis centers. Okay, these patients are at risk. And when it is happening in a hospital or a healthcare place, we call it it as healthcare associated methicillin resistant Staphylococcus aureus, HA MRSA. Okay, capital H, capital A, healthcare associated MRSA. Okay. Usually, when people are undergoing some invasive procedures or devices, patients who are put on invasive devices, okay, or who are undergoing some surgeries, who have been on IV for a long time, or who have artificial hip joints and all, okay, it can also spread from healthcare workers, okay, who are touching the other patients with unclean hands, not doing their hand washing properly, or touching unclean surfaces and not hand washing and then touching the patients. Okay. Then there is another type of MRSA which is called as CA MRSA, that is community acquired, okay, community associated methicillin resistant Staphylococcus aureus infection. And it usually gives you skin boils, pimple like structures on your skin. Okay, and it can spread from skin to skin contact. Okay, and usually the at-risk populations are wrestlers. Okay, those who undergo they participate in wrestling. Okay, childcare workers, people who lived in a very crowded slum kind of a situation. Okay, so these are the different types of MRSA. Then we have VRE, vancomycin resistant enterococcus infection. So it is an intestinal infection. Enterococcus bacteria is the causative agent here. So earlier, enterococcus infections were treated by vancomycin. It was a powerful antibiotic, okay, in the early 2000s as well. But then after 2000s or during the early 2000s, vancomycin resistant enterococcus infection strain was discovered. Okay. Till then, penicillin was working. Then penicillin stopped working. Then the next option you had was vancomycin instead of penicillin. Wherever penicillin could not work, vancomycin was prescribed. And vancomycin was overused as well. And that's the reason why we have the vancomycin resistant enterococcus infection. Okay. So in MRSA, the affected areas from that community associated MRSA infections, it looks swollen. You will have painful red bumps that will look like pimples or spider bites. Okay, that area is warm to touch. There will be pus inside that pimple. Okay, there would be fever as well. Okay, it could be painful boils. It will spread from skin to skin contact. So, because for many decades, antibiotics were unnecessarily used and prescribed. That is the reason why we have this resistant strands of bacteria all over. Okay. Even for flu, cold, viral infection, for everything where antibiotic was not necessary, it was prescribed. That's why we are facing this challenge. Okay. And bacteria are pretty evolutionary in nature. Okay. The way they evolve and the way how they learn to tackle new sets of antibiotics is quite fast. Okay, so germs can survive treatment. Okay, and they on one antibiotic, they will start resisting it and they will learn how to resist it. Okay, so who are at the risk of developing MRSA? People who are hospitalized for a very long period of time. Okay, they are most vulnerable. People who are old age, okay, who are in old age, older adults, and those who have weak immune systems, young kids as well. Okay, and people who have an invasive medical device like central line, ventilator. Okay, these infusion pumps which are put into them for a long period of time. Okay, indwelling catheters and all, they are pathway for these germs to enter inside the body. All forms of medical tubing comes under this case. Okay, and who are residing in a long-term care facility like palliative care facilities and all, nursing homes and all. Okay, they can become carriers to infection. They may not be sick themselves by themselves, but they can spread this infection. Okay, and then the risk of community associated MRSA, whenever anyone is participating in any contact sports like wrestling, boxing, where skin to skin touch is very common. People who live in a very crowded facilities, unsanitary crowded facilities, um, HIV infection, using illicit needles for injecting drug substance abuse. Okay, there are many complications. Infections can affect your bloodstream, your lungs, heart, bones, joints. Okay, so no, so the prevention policies for MRSA is the isolation policy. We'll come to that. So this is VRE. VRE is also a contact spread infection. The person who is suffering from VRE, through their fecal contamination, others may get infected. Okay, the healthcare workers who are treating this patient, okay, if they are using common washrooms and toilets, okay, susceptible patients may get infected. So people who have VRE, they should have a separate bathroom. Okay, they should not use common bathrooms. And if any general equipments are used on a patient who is infected by VRE, like stethoscope, BP machine, BP monitors, thermometers and all, okay, these are general patient care equipments. So you keep it specific to the patient, make it patient specific. Okay, if there is a VRE patient, a separate thermometer, stethoscope, BP monitor will be used on that patient. These equipments will not move around. Okay, it will not go to any other patient. Okay, so that is being patient specific. Okay, using patient specific equipments. And for healthcare workers, the bare minimum that you can do to prevent the spread of these infections are hand wash. Okay, follow the 5 moments of hand washing, and you will be able to stop the spread of infection. That is very important, very key point in tackling VRE, MRSA, or any infections from spreading. So these following procedures should be followed. Okay, whenever you come across a MRSA patient, VRE patient, or any antibiotic resistant patient have been diagnosed, you have to isolate them. Okay, especially MRSA carriers, VRE carriers, and all. You have to isolate them. Okay, do not put them in any other mixed wards. Okay, if accommodation is an issue, you do not have enough isolation wards. All the patients who are suffering from MRSA or VRE, MRSA will be put in one ward. All the patients suffering from VRE will be in another ward. Okay, you have to cohort the patients. And then hand hygiene is a must. Okay, should not miss out on it. Healthcare workers should be trained, retrained. Okay, induction training should be given again and again. Then disinfection. Whenever you have any MRSA patient or VRE patient, at least 2 to 3 times a day, disinfection policies has to be followed in the bed or in the ward wherever they are admitted. Not on the bed, but at least the bedside areas, okay, should be disinfected. And also, when it comes to discharge, once the patient is discharged, terminal disinfection has to be done. That is fumigation, fogging, whatever is required before you put any other patient there. Linen gowns, mask, gloves, okay, for all this, proper disinfection and cleaning has to be done. Protocols, the laundry will follow, the laundry department will follow the protocols. You have to send the MRSA contaminated, patient contaminated linens, okay, and laundry separately, okay. They will do additional disinfection for that. Reusable dishes and utensils can be used. You do not have to use paper dishes or utensils here. Use and throw should not be used, okay. You can be environmental friendly here. Stainless steel utensils can be used, ceramic utensils can be used, because when you wash the utensils with soap and water, the soap and water is enough to kill the bacteria. Okay, so reusable dishes and utensils can be used. Chlorhexidine gluconate bath or wipes or patches should always be there in the isolation room. Okay, chlorhexidine gluconate, this specific antiseptic. Okay, antiseptic is used on living tissues. It's not a disinfectant, it's an antiseptic. Okay, it kills bacteria and it can be used on living tissues. That's the difference between antiseptic and disinfectant. Disinfectant is for the non-living areas, okay, non-living tissues like your floor, walls, and all substances, materials. Okay, it's a really good antiseptic. This bath, using the chlorhexidine gluconate bath, diluting it in water, and using that bath water, okay, for the personal hygiene of the patients. Nowadays, chlorhexidine gluconate wipes are available, just like you have the face wipes and all. These wipes are available. It is much more easier. It's not that tedious to give a complete sponge bath using a wipe. Okay. Then patches are also available wherever the patient has a urinary catheter. You can put a chlorhexidine gluconate patch. So it will prevent this infection from happening or spreading. Terminal disinfection has to be done after discharge, as I mentioned earlier. Duration of contact precautions, how long you will have to continue the contact precautions, because it spreads through contact. Okay, so contact precautions will be put into place, like using gloves and all. Okay, so until and unless you get 3 negative cultures 1 week apart, okay, you have to follow the contact precautions. For example, today is Saturday. Today you got a negative culture. Yesterday you may have sent a sample, or today morning you have sent a sample. And by the evening or afternoon, you got the reports, and the report is saying the patient is negative for MRSA and VRE. Doesn't mean you can discharge them. You have to wait for 1 more week. Okay. Till then, contact precautions will carry on. Again, you will wait for the second negative culture. Okay, the second result was also negative. Again, 1 more week you will wait. Okay, for the third final negative culture. Okay, so 3 negative cultures you got 1 week apart. Okay, so that now you can be sure. Okay, we can discontinue the contact precautions. Okay. So this is what is the protocol of MRSA and VRE. For other patients who have other form of infections, uh, like for example, TB or any other infections, flu and all, as soon as the symptoms are gone, pertaining to that infection, as soon as the symptoms are gone, you can discontinue the contact precautions. Now for TB, tuberculosis, respiratory precautions are a must. Wearing a mask, following cough etiquette, sneeze etiquette, okay, asking the patients to collect the sputum outside, not inside a closed room. Okay, sputum collection should be done outside. So like this, etiquettes, respiratory precautions has to be followed. Whenever in public, they always have to cover their mouth with a mask, handkerchief, or anything. Okay. Separate room is provided for TB patients. If you don't have a separate room, a separate ward is created for TB patients, and all TB patients are put there, cohorting the patients. Okay, that is done. Elective surgery for active TB cases. Okay, patients who are right now having TB, if they have an option, you can decide on what date you can do the surgery. You have to wait for the TB infection to completely resolve and then go for the surgery, until and unless it is an emergency situation. In emergency situation, using all the precautions, surgery has to be done to save the patient's life. Okay, but if it is not an emergency situation, you still have a breathing time, okay, to decide a surgery. Make sure the patient is getting cured of TB as soon as possible, and then you can proceed with the surgery if the time frame allows it. Okay, elective surgery should be postponed for patients with pulmonary and laryngeal TB, especially, okay, until they are no longer infectious. Okay, especially if it is a pulmonary TB or laryngeal TB, elective surgery should be postponed as much as possible, because when the patient goes under surgery, under anesthesia, certain tubings are used to make sure that airway is intact and the patient is still breathing. Okay, to ensure that tubings are used. So when you have pulmonary or laryngeal TB, a lot of mucus is produced, and that can block the tubing, that can block the oxygen flow. So that's a risky situation. Okay. So isolation room, the staff is responsible for taking care of all the isolation, health education, isolation room requirements. Okay. Health education is also given by the staff. They are responsible. They have to teach the visitors what to do, what not to do, what is the situation the patient is going through, what precautions has to be taken care of. Okay, so this health education staff has to give. Hand washing after contact has to be encouraged for the visitors as well. Even if they have not touched the patient or the area, still hand washing is recommended for the visitors after the visiting hours. N95 mask for the visitors is a must. Okay, provision of N95 mask should be made. No more than 2 adult visitors is allowed in the isolation room. Okay, only 2 adult visitors are allowed. Children who are below 12 years of age are not allowed in the isolation room. Visitors' belongings are not supposed to go inside the isolation room. Whatever the visitor brings along with them, it could be a bag, handbag, okay, or any item of personal belonging which they are holding on to their hand, or which is hanging on them or something. It has to be deposited in a safety locker. It has to be kept safe, okay, at the reception of the isolation room. Then the visitors can move in where all the personal protective equipments, and then go inside the negative pressure room, meet the patient, come out of the room, remove discard the personal protective equipment, do their hand washing, come out of the hand washing area, then they can collect their items and then leave. Okay, it should be like that. Patient's bed is only for the patient. Visitors are guided not to touch the patient's bed, or not to even use it for sitting or any other purpose. Okay, the visitors should stay away from the patient's bed. At least keep a few feet distance from the patient's bed. Hand hygiene for visitors is a must. Put posters of hand hygiene, how the 5 moments of hand hygiene, the process of hand hygiene, picture posters. Okay, even if you don't write anything, it's fine, because people who are illiterate, at least looking at the pictures, they will understand how hand washing should be done, how long the hand washing should be done. Okay, prophylactic medication, active immunization is provided to the visitors if necessary. Okay, in certain cases, if you get the immunization, or if you have take the prophylactic medication and then go and visit the COVID patients, or go and visit any infective patients, they are considered much more safe. Okay, so if any immunization is available, give it to the visitors. Okay, guide them and then send it to the isolation room. So this is an example of an isolation facility. This is the general access area. This is where the visitors should deposit their belongings, go inside the change room, wear the PPE, okay, enter the isolation room. It is a negative pressure room. Okay, so the air is pushed out. they have an exhaust system here. Okay, here they have mentioned two exhaust system. E means it's a external windows which has exhaust system. Okay, so air is getting pushed out of the room. Okay, and the air that enters the room is passive air. And then there is a washroom and toilet. Washroom and toilet again should not be used by visitors or staffs. Only it is for the isolation room patients. This is a positive pressure isolation room. Here the air is pushed in. You can see the number of air that enters the room is much higher as compared to the number of air that is leaving the room. Okay, so here you focus on pushing the cleanest air towards the patient. Okay, especially where the patient is lying just under the exhaust system. Here you have the patient. Okay, so this is the positive pressure, opposite of negative pressure. So you can see here the difference in negative pressure isolation room, in which negative pressure is inside, positive pressure is outside. Okay, the air flows easily to the room, but the air is pushed out of the negative pressure room. Okay, in a positive pressure room, the air is the air that enters the room is pushed in. Okay, forcefully pushed in, cleanest air is pushed in, and the air that leaves the positive pressure isolation room is passive. Okay, when you open the door, close the door, whatever air escapes, it escapes. That's it. Okay, there is no control on escaping of the air. So that's about isolation policy. If you have any queries, you can mention in the chat box.